Hi, everyone. Welcome to Being with Carrie. This is the show where I speak with previous guests of the Ultimate Coach podcast. And tonight, my guest is Dr. Jeff Mars. Jeff, thanks.
Thanks for having me on, Carrie. Looking forward to it.
My pleasure. My pleasure. All right, Jeff, you were on the Ultimate Coach podcast, episode number 94, the title Being in Medicine, which is kind of a given, you would think, because you are an orthopedic surgeon, correct?
That's correct.
Perfect. And so medicine is, of course, a huge, huge part of your life, and being in medicine is amazing. You've spoken on stage in Arizona this past January. You spoke, actually, it was just about a year ago in Birmingham, England at 2B24. You and Corey Anderson. And these were amazing, amazing conversations. And there's so much in the talk that you had with Meredith about being in medicine and an interaction that you had with one of your clients that really changed the way that you showed up in your being when it came to being in medicine for you. But I want to pull one quote directly from your talk. And just so everybody out there knows, Jeff has no idea what I'm going to say. I want to pull one thing that you said directly from the conversation you had with Meredith. And I want to just roll with that and see where it goes, because that to me was such an interesting thing that you said. You ready for this, my friend?
Okay, I'm a little nervous, but go ahead.
You said, if you can make something out of nothing, maybe you can make something more out of something.
Yeah, I remember that quote.
Do you?
Yeah, that quote was particularly in the context of how the placebo effect has been studied to work, right?
Oh,
So the placebo effect is a patient's given a treatment or a medication, and they're given a sham treatment like a sugar pill or a fake surgery or whatever. And still, somehow or another, there seems to be some objective improvement or subjective improvement, whatever. They get better. And they get better even though they didn't actually get treated. Well, they didn't get treated with the medicine and they didn't get treated with the surgery, but maybe they got treated. Something happened that produced a change in their thoughts, that produced a change in their experience. And if you want to go Bruce Lipton deep or Joe Dispenza deep, maybe it even actually changed their physiology because of their thoughts. But we call it nothing, but clearly it's not nothing, it's something. But in any case, the point was, if it works, if there's a placebo effect where you can give somebody a sugar pill and still their symptoms get better, well, we're already doing hip replacement and we're already seeing subjective and objective outcomes. Why couldn't we apply that same principle? So the something from something that would be enhanced by whatever that whatever that thing is that gets into a person's thoughts, that changes the way they experience something, that maybe even changes their physiologic response. Maybe they heal quicker, maybe they have less discomfort. I don't know, but there is no such thing as nothing in a treatment because how we're showing up, who we're being, what we're saying, the way we make a person feel or the way a person feels, at least in our presence, is having an impact.
absolutely. As you were speaking, I remembered something that I'd heard. It was probably 20 years ago, and I couldn't even remember where it came from, but I remember reading this story, and it was of this gentleman telling about, I believe it was his church group had made these care packages for some um, country, some village, some something in another country that was very poor and didn't have a whole lot. And they had just thrown together clothing. They had done like wash rags, and they had done aspirin, and they had done all of these things. And then they had put candy and little treats in there. And he stated, again, this was before the internet, before cell phones, and he stated that they received a letter that said, please send over more of that medicine. And they were like, what medicine? And so they actually wrote a letter to the leader of this group. I believe it was like their tribe leader, that said, we're not sure what medicine. Like, are you talking about the aspirin? And they're like, no, the lifesavers that you gave. And so they had put rolls of lifesavers in there, and they said they started giving that to the people in their tribe who were sick, and they suddenly got better. And I've always remembered that when it comes to things, when we're suffering, when we're hurting, how much of that can we apply to ourselves and almost heal ourselves or help other people in that same way?
Oh, that gave me chills. It's so brilliant. And it's true, right? It's if you believe it, if you believe a lifesaver candy is a lifesaver medicine and you believe it and it creates those thoughts, it will have an impact. I mean, I'm not saying anybody who should give up medicine for lifesavers, but really the point is what we believe, our thoughts and our beliefs make a huge difference for us.
Yeah. I think if you were to ask anybody who's considered successful, whether it's an athlete, whether it's somebody in business, whether it's, somebody in the medical field, somebody who has done something that not a huge majority of the population of this world can do, and they say, you ask them if they believed that they could do that. I don't think there's a person out there that could say, no, I didn't believe I could do it.
Right. This reminds me, I had the pleasure to coach with Chris Chitty for a while, and he has an analogy about the comfort zone and the stretch zone and the impossible zone, and how our our stretch zone becomes the possible zone, and the previous impossible zone becomes the stretch zone, and we start to have more and more belief in the things that were previously seemingly impossible. But when you believe it's possible, even if it looks really, really, really hard, maybe even improbable, as long as you believe it's possible, there's a high likelihood of making it happen.
I'm curious if you have any personal experiences with this.
Experiences in creating this previously and seemingly impossible. Yes, I got a million experiences. We all have. You gotta look for miracles to see them, right?
That's a key right there. That's a key right there. If your eyes aren't open to what is in front of you, you're never going to see it.
Hmm, right.
That I love that. Okay, so what I am going to do right now is we're going to go a little bit into the conversation you had, and I want you to tell me in just a little detail. I want you to share some of this placebo effect, not necessarily placebo effect, but this change, what you were talking about, how that it affected you with interacting with your clients, and this whole believing before you even see it.
Yeah. Oh, there's a lot. There's a lot in there. So we go to medical school, we go to residency, we learn a lot about the hows, and the hows create the competence in terms of the procedures that I would be performing. And we also learn a lot of the hows about how to talk to patients, how to talk to patients to make sure that you've told them everything you're supposed to tell them and have a valid informed consent, meaning you've given them all the alternatives and all the risks and what might go wrong. How to make sure our charts are complete so in case we get audited, we don't get in trouble. A lot of the hows revolve around the playing not to lose mentality. So, and I'm not saying any of that's not valid because it's all valid, of course, it's super
Right.
important. And there's something more, there's something else, there's the other side of that coin, and the thing that's actually more important, which is to create, just to see a future created. Like I do a lot of knee replacements and hip replacements, but I'm not creating a bunch of hip replacements and knee replacements. I'm co-creating with my patient and their family and my team. We're co-creating the previously seemingly impossible future where the patient had a degenerative joint, more and more pain, less and less function, more and more disability, less and less ability to live life and do the things they want to do. And if things kept along that path, it's a predictable outcome. Pretty soon they would not be going to their granddaughter's volleyball game or going out in the trout stream. And here we choose as a team to get committed to creating a different future that looks like fishing or traveling or being with your grandkids. And the how, part of the how, is the mechanics of doing the surgery. Big part of the how, the bigger part of the how is what our patient's doing because they carry the ball the majority of the time. But the bigger part of that how is us getting together and being committed to doing what's necessary to create that future.
You spoke about, um, I believe it was called a timeout. There's
Yeah,
another term for it, right? You spoke in the podcast about taking that time out, and what I found really interesting about that is just to briefly share with our listeners. It's where before you go into surgery, you and your entire team, all your nurses, anesthesiology, everybody, you stop and you check off and say, do we have all of our, correct me if I'm wrong, do we have all of our tools? Do we have the correct leg marked? Like we're not putting a hip in a, um, but what's our mission? What's our goal? Like what's the outcome that we're looking for? Things like that as well. And so it's this checklist that you just talked about to make sure that the patient is fully informed. But it's also what I found interesting about it was it's you're working with them and you're putting forth the energy of this when I'm assuming they're already under anesthesia. Is that correct?
the patient is, yeah, that's
Yeah.
correct.
So you're having this, so the patient isn't even fully involved in this, and you guys are having this and bringing this to the patient. And so you're joining forces with what their mission and their goal is, and how powerful that must be. And has that changed at all since this whole interaction that you had with this client that made you change the way that you interact with them on a one-on-one? Has it changed that time out? Has it changed the way that you guys do like bring your mission or your goal into the operating room?
Yeah, it has. So every surgeon does a timeout, or also called a surgical pause. You have to. Basically, it's a checklist. Like you can't take the airplane off without doing your pre-flight check, right? And you're right. It's those things that you say, like we're here to do right knee replacement on name the patient and what kind of anesthesia, and they got their antibiotics, and we know their allergies. And it's a checklist. It's primarily, if you really get down to it, to make sure we're doing the right thing, aka we're not doing the wrong thing, aka we're not making a mistake, aka we're not going to get ourselves in trouble. It's really what it boils down to. Right. So the shift has become all of that happens. It's necessary. But on top of that, we're here as a team. We're not just here to do Mrs. Jones' knee replacement. We're here as a team committed to doing what's necessary to creating the most incredible right knee replacement experience in the universe for Mrs. Jones. And this is a place to stand. It's created in language. It has an impact on how we see ourselves and how we occur for ourselves and how the world occurs for us, and hence has an impact on our actions and hence has an impact on our outcomes. And yeah, Mrs. Jones is laying there under anesthesia when it's happening. But that doesn't mean that she's not co-participating at some level. I mean, the energy in the room from a group of people who are being, we are committed to doing what's necessary, has an impact. So yeah, I think it's made a difference.
Find that your staff has noticed any sort of difference in the outcome of the procedures, the way that the patients heal? Has there been any of that that's been noticeable?
Yeah, I think, well, so the OR team for the most part, except for the PA the PA that I'm working with on that given day, doesn't really have much interaction with the patient outside of
Gotcha.
the OR, right?
Gotcha.
But at least in the room, for sure, definitely see a difference in how the case progresses and how the outcomes go. I mean, I had my shoulder replaced, and I spent a year committing or creating a relationship with my surgeon to the point where he was comfortable looking me in the eye and saying, I'm committed to doing the best shoulder replacement in the history of the universe for you. And I said, here's what I mean by that. What I mean by that is it's surgery. I know you're really good at what you're doing. You're going to give it your best. Doesn't mean something won't go wrong. Doesn't mean we won't have a complication because sometimes things don't go the way we wanted to. But what I can count on is who you're going to show up for, how you're going to show up for me, who you're going to be if something is going wrong, is I'm committed to this being the best shoulder replacement in the history of the universe. And that place to stand creates a different outcome than the hypothetical indoctrinated doctor who would be, oh boy, how do I make sure this wasn't my fault? Or how do I make sure I don't get in trouble? If you're coming from, I don't want to get in trouble, we're going to get a different outcome. If you're coming from, yeah, we had a complication and I'm committed to this being the best shoulder replacement in the whole wide world, it'll have a better outcome. So that's how it is in our OR. You know, sometimes things don't go as planned. I do a lot of really complex revision cases and things where there is no formula per se. And sometimes we're in the room and people are like, Jesus, Louise, I don't know how we're going to get this done. I don't know how it's going to come out. And I'll be like, yeah, well, we know it's going to come out. And maybe I don't know exactly how either in this moment, but what I am committed to is it's going to work out great. And yeah, and it brings a peace and a confidence into the room, I think.
It's you explained something that we can interpret into our own personal lives is functioning from that place of confidence versus functioning from a place of fear. And if you're functioning from a place of fear, you are, I mean, it's been proven, you're literally putting the brakes on that energy and that creation, that ability to create in the way that you would be able to. Where if you function from a space of confidence, not even arrogance, but just confidence and service and love, and have the understanding that maybe everything isn't going to be perfect, I think that's where the miracles can really form. That's where we really get out of our own way, and the creation, the ability to create is just unlimited.
Yeah, 100%. There's unlimited possibility. Miracles are everywhere, all around us. We just have to see them. And when we're in a state of fear, we're not even really thinking with our cortex. You know, we're thinking with our medulla or whatever. We're having animal instinctual responses. We're not actually, we don't have access to our innate wisdom or to the discernment to hear guidance. We just block all that out.
This is so interesting to me how, because when you think of medicine in general, I mean, at least for me, I used to be a standardized patient in a medical college, years ago, and we would critique the students. Like, they would come in and we would have a diagnosis that they had to diagnose us, and we had to just, play the symptoms, and we would have to critique them and check off the list and make sure that they asked every question and said everything and could properly diagnose us. And just, speaking with you shortly and hearing the podcast about how being can be integrated with that, and how it can create miracles even in something that is so structured. It's just beautiful. It's just so beautiful. And thank you for sharing your story of this, and how this has changed you. It's changed your team. It's changed how you do medicine. I think this is an incredibly inspiring story for people. And I think it's going to change a lot of lives in the medical field, as well as just, average Joes who are listening. So thank you.
Well, thank you. I appreciate your openness to allow us to be sharing these ideas. And we want to get those ideas out there because, I'm one guy taking care of some limited number of patients, but we want to spread the word. So thank you for helping us spread the word.
My pleasure. You know what, Jeff, I wish we had more time, but we've got to cut this off. I want to remind everybody quickly, again, the Ultimate Coach podcast. It is episode 94, Being in Medicine. I do want to mention quickly that Jeff and his partner, Corey Anderson, they are starting a podcast very soon. When does that drop?
The official launch date is May 27th.
Okay.
Just so you know, if you're sneaky, the videos are actually already posted so you can listen to them now.
Wonderful. And so by the time this airs, that'll already have been posted. So go find those in the show notes. We'll have the link to that. We'll have the link to how you can get a hold of Jeff and Corey. And yeah, always reach out to myself or Jeff if you have through Facebook, if you have any questions or want to speak further on this. So thanks again, Jeff, for being here. Anything you would like to say quickly before we go?
Oh, thanks, Carrie. Have a great rest of your day.
My pleasure. Thanks again for being here. Thanks, everyone. Love you. Have a wonderful night.